All right. Hello, everyone, and thank you for joining us. We are here live with Dr. Sue Dyson again. I am Megan Phillips of the Train with Trust Project, joined by Jody Ambrose, also of the Train with Trust Project. We are a nonprofit dedicated to making sure that animal behavior education is available and accessible for everyone. And today, Dr. Sue Dyson is going to be helping us sort through the complex health issue of gastric ulcers in horses and issues that come up around that diagnosis. We're excited at Train with Trust Project to be discussing this because the topic of gastric ulcers is important. It's clarified by having a holistic perspective that includes a behavioral approach to elements such as stress reduction. So we're really looking forward to this discussion. I will be in the background. If any of you have questions during our talk, feel free to post those in the comments. And I'll keep an eye out for those and see if we can address those through the conversation. And with that, I will go ahead and turn things over to Jody to get this conversation started.
Okay, I'm excited for this conversation because, I've been in the horse world for a really long time. I feel like ulcers were not a huge part of the conversation around horses and pain and behavior when I was growing up. And then things shifted, I think, when Gastrogard and generic omeprazole became widely available. Suddenly they ulcers started dominating the conversation about both pain and behavioral issues. Um, and so I'm really curious to know what the latest information is and what your perspective is on this, Dr. Dyson. I know that you are not an internal medicine doctor, you're an orthopedic doctor, but you are a behavior expert and you're known for your work in the behavior field. Can you talk a little bit about why you wanted to address ulcers directly?
Well, I thought it was hugely important because a large proportion of horses that I have seen have had an underlying complaint of reduced performance or poor performance. And one of the first things that the owners have done is requested that the horse undergoes gastroscopy. That is, the internal lining of the stomach has been examined to determine the presence or absence of ulcers. And frequently, these horses have undergone treatment, and frequently that has not resulted in resolution of the performance problems, although it has resulted, at least in the short term, resolution of the ulcers. But if some of those horses have then been rescoped after they had been in work for a period of time without ongoing treatment, the ulcers have recurred. So that has always stimulated the question, what is the underlying cause of the ulcers? And why are owners so intrinsically thinking that ulcers are the underlying cause of poor performance, when there is really remarkably little evidence to suggest that they are? In fact, the European College of Veterinary Internal Medicine issued a position statement about gastric ulcers several years ago and said that there was currently no evidence to suggest that gastric ulcers were the primary cause of poor performance in horses. And that's having a body of experts, internal medicine experts, coming together, reviewing the literature collectively and their own personal experiences, and coming out with that statement. So I think it's a very important subject to address. And we also know that there have been a huge number of different studies performed in horses from different work disciplines: race horses, endurance horses, dressage horses, show jumping horses, even feral horses. And they have found that in the majority of horses, there's a high proportion which show some evidence of gastric ulceration, either the squamous form or the glandular form, and we'll come on more to that. So, for example, racehorses, up to 100% of those in training. Endurance horses, 48% out of season, but 100% during the season. Show jumpers in training, 39%. Dressage and show jumping horses, 41%. Leisure horses in Denmark, 26%. So these are hugely high numbers. And the question is, why do they have such a high incidence? And what is the underlying cause? I think that it is now accepted in the world of gastric ulcer experts that if a horse has gastric ulceration based on gastroscopy and it undergoes a course of treatment and the ulcers go away, but only to recur when the horse is in maximal work, then they believe the most common underlying stressor, which is causing the problem, is lameness. And if the lameness is identified and treated, then the ulcers go away, assuming that other management practices have also been put into place, because there are a number of different stressors which we believe are important, and we can come on later to discuss all those, social interaction and the way in which we feed horses, etc. So this is a multifactorial thing, but we must get away with the feeling that every horse which is performing poorly, that is unwilling to go forwards, for example, has gastric ulcers. They may have gastric ulcers, but that is coincidental, really, rather than it being the underlying cause.
I actually got chills when you were talking, because that's such a perspective shift, I think, for the majority of people in our field. I think most of us know those numbers, are aware of, vaguely aware at least, of those numbers, that ulcers are incredibly common in performance horses. And I think most of us have at some time or another been involved in treating a horse with ulcers. But, the way that you just described it, it's like if we were aware of a ligament injury, and so we treated the pain, but kept doing the thing that caused the injury over and over again, expecting it to go away. And then, thinking about pain or lameness being the cause of the ulcer is a completely different mindset, I think, than most of us approach treatment for ulcers. Yeah. It's not that horses don't have ulcers, that they have them, but let's look at why they have them and why they keep reoccurring. So can we back up and start with when horses do have ulcers, what are the symptoms? How should people go about identifying, diagnosing that, and what exactly are they?
Well, let's start with what are they,
okay,
and then we'll come on to what the clinical signs may or may not be and how we diagnose them. So let's have a slide so that we can show the normal internal architecture of a horse's stomach, which I think we'll see very shortly. So we can see, I hope in this slide,
can you make that bigger?
That we have a very pink area and a more orange area. And the very pink area is what we call the non-glandular stomach. And then it is separated from the glandular stomach by a rim of darker tissue, which we call the margo plicatus, which is highlighted by the yellow arrows. And then to the right of the image is the glandular stomach. And we see ulcers that can occur either in the non-glandular or squamous part of the stomach, or the glandular part of the stomach, or both. Now, the glandular part of the stomach is the bottom part of the stomach in general terms, and the non-glandular or squamous part is nearer the top. The glandular part produces hydrochloric acid, and particularly when horses are exercising, that hydrochloric acid can come up to the top part of the stomach because the stomach contents are influenced by abdominal pressure, and the abdominal pressure goes up during exercise, and continued splashing of the squamous part of the stomach with hydrochloric acid can cause erosion of the stomach wall, the squamous cells, resulting in ulceration. So if we go to the next slide, I think we can see an example of, on the right, you can see highlighted by the red arrows and the blue circle or blue oval, areas of squamous ulcers. So these are close to the margin plicatus, but they can be further away. They could be more diffuse. And there's a specific way of grading them based on their severity and their depth. They're graded on a 0 to 5 basis, and these would be graded 2 out of 5.
Wow.
And just as a comment, in order to be able to evaluate the internal lining of the stomach, you have to have a very long gastroscope, which is passed down the esophagus into the stomach. The horse has to have been starved prior to this, because otherwise there will be too much gastric content within the stomach, which will prohibit you evaluating these areas of the stomach. So the horse has to be starved overnight before we look inside the stomach.
Would this be something that the average vet in the field would be able to do, or would this be something that you need to go to the hospital to?
There are some specialist equine internal medicine people who are mobile and have a gastroscope, and therefore could do it out in the field. More commonly, probably, it's done in a clinic situation. But gastroscopes have become quite commonly used and are reasonably easy to use. And then if we go to the next slide, these are glandular ulcers within the glandular part of the stomach.
Right.
And these ulcers are probably the result of failure of the normal glandular defense mechanisms, and probably are stress induced. So what about the symptoms? And that's a really difficult question to answer, because there's a long list of things that have been reported in the literature as possibly being signs of gastric ulceration.
Pretty much it seems like everything is on that.
Reduced appetite, weight loss, reduced body condition score, reaction to girth tightening, behavioral changes, anxiety, aggression, grumpiness, poor performance, reluctance to go forwards, teeth grinding, diarrhea, self-mutilation, cutaneous hypersensitivity. The list goes on. So they're all very non-specific signs which could be caused by a multitude of things. So, for example, if you look at reaction to girth tightening, we have done a study when we observed horses during girth tightening, and we observed abnormal behavior, horses turning their head towards the girth, horses kicking out, swishing their tail, baring their teeth, biting, etc. But we saw an association with this behavior with either an ill-fitting saddle or the presence of lameness. There was a small study at the University of California, Davis, in which they reported on 37 horses which were presented specifically for girthy behavior during tacking up. And of those, 12 did have gastric ulceration, but that meant that 25, that's 2/3 of them, did not have gastric ulceration. They had other causes, mostly lameness. So the signs are very, very vague, and we don't know specifically. In fact, I spent an hour having a meeting today with some pain experts discussing how we could progress in doing a prospective study to better define the behaviors that may be attributable to gastric ulceration. But that's not a particularly easy study to do, because we know that in so many horses, they have underlying stressors. They could have a chronic corneal ulcer. They could be socially deprived. They could be a crib biter. They could be a lame horse. So that's why it's so difficult to tease out what are the specific behaviors that are solely related to gastric ulceration.
Yeah, it seems it's not a linear thing in any way. As you're talking, I'm picturing basically a circular diagram,
yeah.
or an overlapping Venn diagram, because I know I've read that, cribbing has a high incidence of correlating to ulcers, but nobody's ever been able to determine whether cribbing causes ulcers or ulcers cause cribbing, or both.
Yeah, absolutely not.
But it makes sense if they both come from stress.
Yeah, exactly.
Yeah.
And I think we tend to underestimate the circumstances which can create stress in horses.
Right. And that's what we do, is we address the underlying causes based on behavior management. So many of the things that we do to manage horses, whether it's the way we ride them or the way we stable them, the way we feed them, that's all part of the purpose of addressing behavior as a whole, because behavior is how horses communicate with us. And when the behavior changes, that's how they talk to us.
Yeah.
But it's interesting, as you were speaking about the symptoms of ulcers, I realized it's not just that these drugs are available to treat it that made it such a popular thing to diagnose horses with. It's also that literally almost anything that a horse is doing behaviorally can be explained by saying it has ulcers, because it's such a broad category of symptoms.
Yes, but it's kind of chicken and egg situation, which
Right.
comes first.
Right.
And so if we're going to make a diagnosis, we have to do gastroscopy. We have to pass this long tube into the stomach in order to identify the ulcers. But in order to successfully manage the horse on a long-term basis, one has to try and understand what the potential stressors are. Is it diet related? Is it restricted access to water? Is it restricted access to other horses in an appropriate social environment? Is it exacerbated by transport? There are just so many factors that potentially can come into play. Is the horse being fed a diet which is not adequate in terms of the provision of fiber?
Right.
Is it too much rich in non-structural carbohydrates? There are all sorts of things that we have to be considering.
Yes, I know one area where it seems like there has been a lot of progress is in understanding that forage needs to be available continuously, not in short bursts. I know growing up, the horses ate for maybe 3 hours a day, and now slow feeding has become more common, although not universal.
Yeah. Well, we have to think about what happens in the natural environment. The
Right.
horse is a grazer, so it's constantly chewing. And with chewing, it provides saliva. And saliva is in part swallowed into the stomach. And saliva has a higher pH than hydrochloric acid. So the pH, the lower the pH, the more acidic the environment. The higher the pH, the more alkaline the environment. We don't want a very acidic environment. By provision of saliva, by constant chewing, we can provide a more alkaline environment, which is better in terms of the management of or prevention of squamous gastric ulceration, because those are induced by the exposure to hydrochloric acid.
Right.
And I think it's also important to recognize that we have gastric ulcers in people, and we know they are in part induced by a bacteria, Heliobacteria, but we know from studies that if you do a multivariable analysis of variants to determine what other factors may be important, stress comes out as important in human gastric ulceration. So there are similes between what happens in humans as there is in people, although the human stomach has a different structure. What is interesting is the rat has a very similar structure of its stomach compared with the horse. So there's been some interesting studies done in rats,
that's interesting,
from which we can draw corollaries from the horse. So we know that if rats get stressed, they have more ulcers.
That's interesting.
So there was a particularly interesting study in which rats were potentially going to be exposed to an electric shock. So we had a group of control rats who had no shock, a group of rats that were warned about the shock coming by a light flashing, and then a group of rats which got no warning and received the electric shock. And the extent of gastric ulceration was by far the greatest in the rats that were shocked without warning.
Oh, that's really interesting.
Compared with the rats that got the warning, who also had more ulcers than the rats that did not get the stress of the shock. So that's more evidence about the role of stress.
That's very interesting. That fits with some of the work we do, training horses for cooperative care, for voluntary husbandry to participate in their care, that, things like injections or any kind of painful or aversive treatment. One of the things that we try to do is inform the animal about, and train them about what's going to happen, and what's going to happen, more importantly, after, that it's going to stop, it's not going to continue. And it is interesting to see how something that really is aversive can become less aversive. And then I think about with feeding, if we're talking about feeding horses, and how aversive it can be when they don't know when their food's going to arrive, and they get worked up and stressed out waiting
Absolutely.
for their food. And there's some interesting implications with maybe some management techniques that could happen for, that horses maybe don't have to spend so much time questioning and anticipating when something's going to happen. Maybe we can train them to understand their environment better, and maybe that's a way to reduce stress. Getting a little off topic, but that's our.
But I think it's very relevant. I think we have to learn more about stress in horses. And Gemma Pearson from the University of Edinburgh did a really interesting study looking at veterinary interventions. So taking horses which were in the clinic for investigation and looking at their behaviors during, for example, scrubbing before an injection, and then actually doing the injection and going on. And then also measuring salivary cortisol levels, the cortisol level being an indicator of stress. The higher the cortisol, the higher, we presume, at least in the acute stress, the higher the level of stress incurred by the horse. And they saw that there were horses that would stand stoically and apparently not be too disturbed by the situation. And then there were those horses that were very restless, and some of them were quite difficult. But actually, when you looked at the cortisol levels, coping doesn't equate with the absence of stress, because some of the horses that were apparently compliant had higher cortisol levels than those which were fidgeting. So they were kind of bottling it all up inside and therefore getting actually more stressed. So we call this kind of proactive coping.
Yeah.
But it's stressful to do that.
Yeah, and that's a huge paradigm shift for horse people to recognize that stress doesn't necessarily look like acting out, but that shutting down and learned helplessness are also and I think a lot of times this is not probably not a medically sound opinion, but I think sometimes animals that shut down are more likely to sort of eat away at their own bodies and have internal problems. I think sometimes expressing that anxiety outwardly. Some of
Yeah.
those horses are healthy because that's what we're supposed to do. We're not supposed to turn it inward on ourselves. And I think as people, we know that letting things out is a healthy coping mechanism compared to turning it inward. So yeah, again, it's this topic in particular is so fascinating as a behavior person because it is so overlapping with the medical veterinary part of the equation, and it's another example. We talk all the time about needing a team approach to addressing issues with your horse and having a vet, a farrier, a body worker, a trainer, all of these people in place, and a behavior consultant is a critical part of that when you've got these kinds of issues as well. So going back to horses that actually do have ulcers and are having issues based on ulcers, can you talk a little bit um, about the types of food, um, what the effect of certain? I know you talked about fiber, but are there other aspects of food that are important to consider?
Yes, there are. There was a relatively recent study which showed that increased starch in pelleted food was more likely to be associated with ulcers than in mixes. More than 6 hours between forage feeds was a major stressor. And there was also a very interesting study in Iceland recently, which was intriguing because the Icelandic horses were getting forage, but it depended on the type of forage that they were getting as to how susceptible they were to ulcers. So if the forage is too coarse, it can cause physical abrasions of the lining of the stomach, which can predispose to the development of ulcers.
Oh, that's interesting.
So that was intriguing. So just to be able to say they're out on with access to forage doesn't necessarily equate with that forage being the appropriate forage based on that Icelandic study.
Oh, that's really, really interesting. There's so many things to take into consideration when you're looking at hay
Yes.
that we had no idea about, and the texture is not something that I've ever heard anyone address. Really interesting. Um, so uh, so obviously feeding is a huge part of treating ulcers. Um, but can you talk about some of the things that get blamed on ulcers um, that and treated as ulcers that are not ulcers? Obviously, that's sort of a broad category and a huge part of your work.
Yeah, I mean, I would see, and I think that now many of the gastric ulcer people believe that lameness, not necessarily overt lameness, but underlying musculoskeletal pain is a very strong cause of the development of ulcers. And unless you address that musculoskeletal pain, the ulcers are not going to go away. And there was an interesting study done in polo ponies. Polo ponies have a very high incidence of lameness. And in order to maintain the game of polo, the use of phenylbutazone or bute is allowed in polo, in order to try and encourage people to have the ponies as comfortable as possible. And when they did a study of gastric ulcers, they found that the use of phenylbutazone was actually protective for ulcers, whereas many people historically would have said, oh, phenylbutazone is bad for the stomach. We can't use phenylbutazone in the face of gastric ulcers. But in this study in polo ponies, the use of phenylbutazone was protective.
Oh, that's fascinating. So basically reducing their pain reduced the incidence of ulcers because they were causative. Is that the
Yes, that's the interpretation. Yeah.
That's, again, I mean, earth shaking for horse people, because I think even before ulcers became sort of the catch-all diagnosis for issues, I think it was assumed that chronic use of bute was a cause of ulcers and contraindicated.
Yeah, and I think the evidence is that if you were to continue to use phenylbutazone at very high levels on a continued basis, then that may predispose to gastrointestinal problems. But used at standard therapeutic doses, it is probably protective. So there's no reason, if you've got a horse with chronic low-grade lameness, not to use phenylbutazone, in my view, to control pain. I think it's a very effective controller of musculoskeletal pain. It's cheap and well tolerated by the majority of horses, and I'm a strong advocate of its use. And in fact, it used to be, way back when I first started as a veterinarian, it used to be permitted at low levels in international competition. And when it got banned, we saw a much higher level of the use of intra-articular or joint injections, with the resulting then as proportion of horses got joint infections or joint flares, which we'd never seen before.
Yeah.
Because we were changing the way in which we were managing these horses.
That again, such a huge point. I remember as a kid, I had an elderly school horse type mare, and we would go to horse shows, and she would always get a bute before we went to shows, and she was always super energetic and a completely different horse at shows. And so I think back on that, knowing what I know now, and I think, oh, she was in pain all the time, and when we went to shows, she felt good.
Yeah.
And it's like, okay, why weren't we giving her bute all the time? That would have made sense, but that's not how we tend to look at behavior and pain. Along those lines, I think, you're talking about that bute is cheap and fairly, easy to administer. I do think that the over reliance on the diagnosis of ulcers has a lot to do with the availability of omeprazole, and that it's something that people are able to administer themselves by themselves now. Is there harm in treating without knowing if the behavior is being caused by ulcers? Is it something that you recommend doing in concert with diagnosing orthopedic problems?
Well, there's harm to your pocket. It's an expensive drug. So I would see no reason not to treat for one course of treatment. But if you're going to be requiring multiple doses, which is expensive, then I would say unquestionably there has to be some other underlying cause. So it is pointless to keep going like that. You need to identify what the underlying causes are. Is it related to the management of the horse? Is the horse in social isolation in a single stable? There was an interesting study published very, very recently when at the Horse Trust, they rehome former police horses that were very used to being stabled. But now at the Horse Trust, they live out 24/7 most of the time. And they did a study when they either brought them in to a stable with a full wall, so they couldn't communicate at all or see the horse next door, or a barred wall where they could see the next door horse but not touch it, or a half wall where they could both see and touch the adjacent horse. So these horses who had historically been used to being stabled for most of their working lives were now living out all the time, and they were brought in and for an hour with a mate, a horse that they knew that they got on with. And if there was a solid wall, so they couldn't see each other or touch each other, they spent much less time resting and were more agitated. And when they were able to touch, they were much more relaxed. They would lie down more. They wouldn't show any picking up the legs and stamping. They showed no stereotypic behaviors, whereas when they were socially isolated, only for an hour, some of them started to crib or windsuck. So that shows an incredibly quick reaction to social isolation. And to me, highlights how important it is that we create environments in which the horses can interact.
Yeah, I think that's a hugely underrated thing that we have control over, some control over, that people don't recognize in the behavior realm. We talk in terms of animal welfare. One of the more sort of basic underlying concepts is we talk about the 3 F's, which is friends, forage, and freedom. And forage, as I mentioned, seemed to have come a long way in terms of understanding availability at the very least, and in some cases type. It sounds like there's a lot more that we need to know and address, but the friends aspect is one that I think, particularly in performance horses, particularly in urban settings, where there's not access to as much room to keep horses in pasture, that social isolation, and the more expensive a horse is, the more isolated I think it tends to be, because people are worried about them getting injured. But if you're causing so much stress that your horse has performance issues and behavioral issues and pain, because of the way that you're managing them, you're really sort of causing the thing that you're trying to avoid by keeping them isolated. So I think that's something that people people can address, and
Absolutely.
yeah, and sometimes that means slow introductions, which I think is something that people need more education about. It's not just throwing a horse out in a pasture and hoping for the best. In zoos, you see them do systematic, gradual introductions where you basically wait to put them in together until they're face to face and ignoring each other, not triggered by each other. And that's when you put them together. You don't just throw them in. And so there are ways that we can increase their social opportunities without putting them at risk.
And you have to realize that some horses are mates and others are not.
Right.
And there's
just
no
like
point
people.
yeah, exactly. So it's no point not putting it with its buddy and trying to put it with somebody it doesn't like. That doesn't work for us, and it doesn't work for them.
Right. And it's a self-fulfilling prophecy too, because if a horse is socially isolated its entire life, it's not going to have good social skills. It's not going to be good at interacting with other horses a lot of the time. And so sometimes those horses need to be given opportunity to be social in a limited way, in a protected way. And so there are ways to approach these things and allow these opportunities safely. And that's something that we could talk about in a whole other live. But and then talking about the 3 F's, the other one is freedom, and I think that's another one that we don't address, and it comes back to talking about the horse that's shut down and not expressing themselves. We do a lot with enrichment and with teaching people how to provide choice and control. It also comes back to the conversation about predictability and allowing horses to have information about what's going to happen to them and participate in the things that happen to them. And, we take so much of that away from them in the way that we handle them and manage them. So I think there's a lot of focus on forage when it comes to these things, and we really need to talk more about friends and freedom. And again, we can talk about that another time, but I think it's great that this is coming up, because when you talk about horses in pain, these are important concepts.
Yes,
These are not
and,
just,
and also just for a horse that's got any musculoskeletal pain, we've gone through a cycle where for a while everybody was shutting horses up and just putting them on stable rest. But
yes,
that's completely non-physiological, as well as
great
being a
point.
stressor. And horses need to be mobile. We don't want them galloping across a field and doing a sliding stop if they are in a rehabilitation program, but nor, I feel very strongly, do we want them confined within a stable. I think
Yeah,
that's
that's a
really,
great point too. I think we've talked about doing another live on rehabilitation procedures, and that is something that I think I think it's changed a little bit in terms of putting horses on long-term stall rest when they're injured. But I think it's still very prevalent that
yeah.
that's how things are managed, and that also leads to social isolation a lot of the time. Um, and sometimes, immobilization is probably necessary, but there are things you can do to provide, again, safe opportunity for the things that the basic needs being met. Um, so yeah, so much to talk about on that.
But I think that Charlotte Dujardin and Carl Hester have pioneered at the upper level, saying we turn out all our horses.
Yes, yeah, there are a few
It can
business
be done,
providers.
and it can be done safely. And yes, there's going to be an occasional accident in a field, but the overall well-being of the horse is going to be so much better if it
Right.
has turnout with
Yeah,
its
it
name.
requires people to recognize that not turning them out is also harmful.
Yeah,
You're not protecting them by keeping them in.
yeah.
Um, yeah, exactly. And I do think that that's starting to, it's a part of the whole bigger conversation about welfare and social license and all of that we've been talking about in some of these conversations. Um, so to continue talking about reducing stress, if we're just talking about addressing issues that are caused by ulcers, can you talk a little bit about stress and riding? And because we've talked a lot about stabling and just basic management, but the obviously the thing that we are the most a factor in is the period of time during the day when we are tacking them up and riding them. Can you talk about some of the elements that we can look at for reducing the incidence of ulcers?
Well, I think it's being vigilant, and that goes back to being observant, looking and seeing and thinking. So watching the behavior of the horse as you come into the stable with the tack. If it retreats to the back of the stall, that's not normal. If the horse avoids you wanting to put the reins over its head by putting its head up, that's not normal. So you have to be thinking, why is the horse behaving like this? Similarly, if it doesn't want to stand at the mounting block, there has to be an underlying reason, unless the horse hasn't been trained to stand at the mounting block. So we're looking at behavioral ways in which the horse is communicating to us that something is not right, be it the tack or the anticipation of discomfort during ridden exercise due to either primary musculoskeletal pain or sometimes the fact that the rider is in an inappropriate position because the saddle doesn't fit them and they are out of balance or they're sitting very crookedly, which may induce secondary pain
Yeah.
in the horse. And then we can use the ridden horse pain ethogram to monitor the horse's comfort. That's the 24 behaviors during ridden exercise. And in fact, Professor Ben Sykes talked at the American Association of Equine Practitioners last weekend about the use of the ridden horse pain ethogram in horses with gastric ulceration,
Oh,
because he
really?
feels it's so important for us to recognize that those horses which are blamed as having primary ulcers often have musculoskeletal pain. And a good way of identifying that is by using the ridden horse pain ethogram. So here is an internal medicine person saying, use the ridden horse pain ethogram to facilitate the identification of musculoskeletal pain. So I think we need always to be thinking when we're riding the horse, if it's unwilling to go, why is it unwilling to go? Has it got pain? Or is it perhaps the fact that it hasn't been trained appropriately? But there has to be a reason all the time, because a normal horse is not a grumpy horse. A normal horse should be responsive to the cues, assuming that the cues are delivered in a clear way without confusion. So it's no good applying the accelerator with the handbrake on, so applying a leg cue with over-restricted hands, because that's very confusing to the horse. But if the horse is appropriately trained and it is pain-free, it should be working comfortably and happily and harmoniously. And if it's not, we need to be asking all the time, why? And not necessarily blaming ourselves, because often riders blame themselves. And I think that's often, they feel they're letting the horse down. And I don't think that that's necessarily the case. I think we have to be always thinking holistically as to why things are not going right.
Yeah, as a trainer, I think that's absolutely true that people do blame themselves in their riding skill, and trainers tend to want things to be blamed on the rider because that's something that they have control over and know how to fix. But I would say in that aspect, we probably, are putting too much blame on ourselves. But in another way, it is up to us because I can say that using the ethogram, when I first was introduced to it, I thought of it as a diagnostic tool for figuring out when a horse is in pain. But using it on a regular basis to establish a baseline and identify changes as they happen, I think for me has been the biggest game changer. Being able to look at a horse and say, okay, this is new, this is different, this is getting better, or this is getting worse has been huge. And I'm going to give a little plug to your book, Harmonious Horsemanship, because I've been using the ethogram for a while, and I'll give a little plug to our free illustrated field guide that's available on our website. It's very handy to have on my phone that I use when I'm looking at a horse. I can scroll through it and pick up on different behaviors as I'm watching a student. But also the book has really helped me in looking closely at these behaviors and understanding how and when they're significant.
The other thing I think we need to think about is our methodology of training. And there's been a huge furore about Andreas Heldstrand and his methods. But I went to the British Dressage Convention 2 weekends ago and watched a variety of our top coaches and riders working with horses. And there was an overriding picture of softness and harmony. And if a horse was struggling with a movement, rather than repeatedly trying to put the horse into that specific movement to improve it, each trainer thought, hey, what should I do? Let's ask the horse to do something different that enabled the horse to learn in a different way how to use its body appropriately, then giving it a rest period, and then coming back to perform the original movement. So it was a very sensible, thinking out a little bit outside the box method of training, rather than pressure, 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 pressure. We must repeat this movement, repeat, 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 repeat,
right,
with the horse getting more and more stressed until the movement was right. So I think we have to also think about how we train horses and how they learn.
Yes, absolutely. I think that's a great point. And obviously that's sort of the elephant in the room that everyone is talking about, the use of force, the use of aversives. There's argument about positive reinforcement and negative reinforcement and all of these things. And I think the key is understanding the tools that we're using and why we're using them and how they influence the horse. And then also correct training. which is, is a loaded term because people disagree on what correct means, but teaching a horse to use themselves properly obviously is a huge factor in soundness and stress.
And creating variety for them so that they're not doing
Yes.
the same thing all the time. So we're hacking out around the countryside if it's available. We're going outside. We're jumping small fences, as if it's a dressage horse. We're allowing the horse to gallop because it's going to have fun. And
Right,
horses need
right.
to have fun.
Yeah. Which we teach enrichment clinics, and enrichment is a term that's used in zoos. But there's a lot of conversation about not using that word to describe it because enrichment makes it sound like it is something that you add on top of all of the things that are required. And really it's essential. It's not an extra thing. Training is enriching if done properly. And there are other things that you can do, to provide enrichment. And really it's about experiences, providing different opportunity for horses to use their brains, to use their bodies, to use their natural instincts. And again, whole other topic. And I think if I have a takeaway from this whole conversation, it's that the topic of ulcers is something that that gives us an opportunity to address a whole system of how we manage horses, how we keep horses, and think about their welfare in a different way. So I think this is, I think maybe the best overarching topic for a conversation that we could have chosen, and will lead to a whole bunch of other really interesting conversations.
I would
Megan, I
want
don't know
people
if
to
there's
go
anybody.
away with thinking that there are horses that do have gastric ulceration that is treated once and it goes away.
Right,
And that certainly does happen.
right,
But there are more horses in which that doesn't happen because there are underlying stressors. And when you're treating, it's not just a case of giving omeprazole, that's Gastrogard. We do have to address diet and management as well. And with respect to the glandular disease doesn't respond as well to omeprazole as does the squamous form. And we often will provide also either sucralfate or misoprostol, which provides a kind of coating to the gastric wall, which may be in part protective. But again, we have to address the stressors that are probably the underlying factor.
right. And addressing those things is going to be beneficial regardless of the cause.
Yeah.
Whether it's addressing pain or addressing stress, it's always a good thing and always what we really should be doing.
Yeah.
So Megan, are you there?
I am here, and I am just going to put up our end screen. It's a lot going on for my poor little laptop. So it takes a second to get these up here. So yeah, we wanted to just thank everybody for being here. This has been an exciting year that we've started these Facebook Lives. And there's a lot for everybody to look back at, but we do want to look forward to our next topic, which will be on Thursday, January 18th. And one of the things that Dr. Sue has mentioned a number of times is that it's really important for people to understand, what does a happy horse look like? Dr. Sue, you have mentioned that many people learn on horses who may be experiencing pain. Do you want to talk a little bit about what this idea, where this comes from for our next live? What does a happy horse look like?
Yeah. I think that we've lost sight perhaps of what a happy horse looks like, because many of us learned to ride at riding schools where we were exposed to these wonderful, slow, compliant horses, and they were slow and compliant because they were uncomfortable, but they exhibited various abnormal behaviors such as ears back, tail swishing, being reluctant to go. And so that became what we accepted as normal. And it's not normal. And therefore, I think we have to learn to know what the really normal horse looks like.
Great. Well, that's what we will be talking about to start out the new year. So, we're also really grateful to everybody who's joined in, everybody who's been watching the recordings afterwards, our friends in Australia. It's very difficult for us to coordinate a time between the UK and the United States that also works out well for Australia. So we know a number of you are watching recordings around the world. So we really appreciate that. And you all know how important this information is to share with everyone else. So help us spread the word, invite people to follow our social media, take a visit to our websites and find out ways that you can help increase everyone's knowledge so that we can all work towards bettering the care of our equine partners. Another reminder about Dr. Dyson's book that she co-authored with Sue Palmer, Harmonious Horsemanship, Use of the Ridden Horse Ethogram to Optimize Potential, Partnership, and Performance. It's available as an ebook as well as for print. And at 24horsebehaviors.org, we have additional checklists up. So we have the Ridden Horse Ethogram, the 24 behaviors, in a revised state that has the definitions of the behaviors on the checklist worksheet. Dr. Dyson has also provided some information about how to select a veterinarian who might be best equipped to help you with a lameness issue. Information that you can provide to your veterinarian that will give a thorough history to help understand what's going on with your horse. And for those of you who are veterinarians, this providing a thorough history checklist can be shared with your clients to help make sure that you are solving this problem collaboratively with a really detailed history. And as Dr. Dyson referred to during our conversation, these behaviors such as during tacking up and mounting, these other behaviors that weren't part of the 24 behaviors ethogram, there are many other behaviors that could indicate an underlying pain or lameness that could be in the making with your horse. So those checklists are available at 24horsebehaviors.org. And we also have posters for sale, things that you can do to help spread the word, help raise the visibility of these really important issues. So thank you, everyone, for joining us throughout all these talks, for commenting, sharing, posting your questions. We did have a couple of questions come through.
Yeah, I actually got one too. I don't know if we want to.
Yeah. Dr. Dyson, do you want to listen to these questions? And in some cases, it's easier to answer these offline, but in some cases, you might be able to answer them right away. Jody, did you want to go ahead with your question first that you received? Or
Sure. I got a question from a veterinarian asking about the potential harms of using omeprazole. She said some studies have come out about upregulation of proton pumps in the stomach, which can lead to rebound effect, especially if it stops suddenly. She wonders how much this contributes to horses with chronically recurrent ulcers. And a second concern would be nutrient absorption.
I mean, this is the reason why I would be reluctant personally to be advocating the use of more than one course of omeprazole, because we might have these secondary problems. So for me, it's really, really important to go back and say, if we've got recurrent ulcers after the first treatment course, why? I don't think when I've talked to the experts that a single treatment is likely to result in adverse events.
good to know. And so a couple of questions that came through in the chat. One was, what is your preferred form of treatment? And are there any supplements that you've found helpful to prevent recurrence? And we did have this note, as in some cases, these supplements are a whole conversation unto themselves. A related question was, are there any studies on long-term use of devil's claw as pain relief. So
Um,
with those sort of lumped together, do you have any response to those?
there is no evidence about supplements. There's lots of evidence about supplements that haven't been efficacious. There was a recent review article published in Animals, which is an open access review, which reviews of a number of different papers, which looked at the addition of a variety of different supplements, none of which turned out to be beneficial. With respect to the devil's claw, there's been no scientific study that I'm aware of that has looked at the efficacy or otherwise of devil's claw.
When you say none of the supplements were shown to be efficacious, is that for pain? Is that for ulcers or both?
No, that's for ulcers. This
Okay,
review article was about the potential different management factors for ulcers.
got
Yeah.
it. That's interesting.
Great. Well, I think that helps us wrap things up. If you do have additional questions after this is over, again, send those our way and we'll do our best to get those answered for you. And we will look forward to seeing everybody on January 18th next year. Have great holidays and Happy New Year.
All right.
And as always, Dr. Sue, thank you so much for being available to help everyone have a better understanding of horses.
You're welcome.